September is PCOS Awareness Month. We're joined for this Mindful Monday discussion by Dr. Pamela Rice, OBGYN at Winona Health. Good morning, Dr. Rice. Thank you for being here.
Thank you. Good morning.
Nice to see you. So just start, PCOS is an acronym that we hear a lot, but I think maybe a lot of people may not know what it is. So what should we know about the condition?
So PCOS stands for Polycystic Ovarian Syndrome, and it's important to know that it's common, it's treatable, and it's important to get that correct diagnosis if a patient has it.
Okay, yeah. And so what are some of those symptoms we should be aware of?
Yeah, so the symptoms that patients should be on the lookout for is late onset signs of hyperandrogenism, and by that we mean evidence of male hormone influence in women.
Okay.
So things like increased adult onset acne, growth of hair in a male distribution, such as increased hair on the chin, down the middle of the chest.
Things like that. Okay, and we had some of the other symptoms up on our screen now for people to look at. And so if women are experiencing some of these symptoms, what should we do? What's that first step?
Yes, so I think the important step to that is to seek help from a healthcare provider to get that diagnosis made.
Yep.
So there's different criteria for making the diagnosis, and several different organizations have different criteria.
Okay.
But the most commonly accepted group of criteria are called the Rotterdam criteria. That was a group of endocrinologists who came up with the criteria they wanted to have people make that diagnosis.
Okay.
So the three steps to it primarily are signs of hyperandrogenism, as we discussed, irregular periods, which are due to irregular ovulation.
Okay.
And the third criteria for patients can be on ultrasound, finding multiple little cysts around one or both of the ovaries.
Okay. And so you did mention it is treatable. What are some of those treatment options?
So the treatment options should really be tailored to the patient's desires at the time. So some patients' goal is to seek fertility. They can have difficulty with that because they may not be ovulating on a regular basis.
Okay.
So those patients are candidates for ovulation induction agents.
Okay.
Some patients don't have that as their primary goal at the time. So it can be to restore having a regular cycle. It can be to treat the signs of hyperandrogenism, and really to just maintain general good health. So we know that it is associated with an increased risk of uterine cancer. And so one of our goals is to help people preserve their health as well.
Okay, yeah, excellent. So as you did mention, a common belief is that PCOS couldn't cause infertility, or maybe that they are linked there. What is the truth there, and what should people know about that?
It definitely can be linked because it prevents women from having regular ovulation.
Right.
So women who don't ovulate on that regular basis can have difficulty becoming pregnant, either for the timing of their ovulation or lacking it altogether. So the ovulation induction agents can help overcome that.
Okay, great. So there is a link, but nothing to be too concerned about, right? Talk to your
doctor. Correct, it's treatable.
Okay, awesome. And yeah, so any women going through this, I guess your advice would just be to find a good healthcare provider they can speak with?
Yes, ma'am.
Okay, great. Anything else you want people to know about it?
I think people should know that it's common, it's treatable, and that I think the patient's treatment plan should be tailored at the time toward what their goals are at the time. So our goal always for patients is good health.
Yes.
So this has been linked to heart disease because it can be linked to high cholesterol.
Okay.
It is definitely linked to insulin insensitivity. And what I mean by that is that patients produce the normal amount of insulin, but their body doesn't process it.
Okay.
So it is tied to being overweight or having issues with obesity. And we're not sure what comes first.
Okay.
We're not sure if being overweight or obese can increase your risk for having it, or if just the hormone imbalance will make it more difficult to maintain weight or lose weight.
Okay, interesting. So definitely a larger health picture there.
Correct.
All right, so speak with your doctor. Okay,
Yes,
well, thank you so much, Dr. Rice, for being here, telling us about this. We appreciate your insight.
Thank you.
No problem. Stay with us. We're back right after this.